every year, and it costs Medicare nearly $100 billion every single year. So it's a huge problem clinically and a huge problem financially. The whole of the Western world is the #1 cause of preventable disability, and in the developing world, it's a huge problem.
But it's always in the top. I mean,
it's always in the top 3 or 4, absolutely, yes.
Why apply artificial intelligence to strokes in particular?
So when I came over to Stanford, to California in 2014, it was a very interesting time. Early 2015, 5 randomized controlled trials were stopped early in the world of stroke. They prove we have a treatment for stroke if it's performed fast enough. Unfortunately, not many people were getting that treatment in time. The numbers were around 5 in every 100 patients are able to access that treatment in time. At the same time, in 2014, 2015, AI was developing in a very significant way in the form of deep learning. And what deep learning is really good at is recognizing patterns in complex data and categorizing that data into different categories. As doctors, what we do is we look at medical images and we recognize patterns in those images, and we categorize those medical images into a differential diagnosis. So it's the same thing. And so what we realized as a team was that we could potentially apply deep learning to medical images to trigger a much faster recognition of the condition of stroke and certain types of stroke in particular, to improve the identification of these patients who need treatment and also the speed and efficiency of treatment.
It's a software that is able to do it, but you have to gain that knowledge. So how do you gain that knowledge that the software can better detect a stroke?
Deep learning works by training neural nets, and typically neural nets with statistical models in between the layers of neural nets, which learn every time you put data through it. And so what you typically will do is have an expert radiologist, for example, train the algorithm by inputting different images that the expert has categorized and labeled. And each time the algorithm sees it, it will learn and change a little bit until it gets to the point where it's as good as the expert radiologist.
Does it have the potential to be better?
I think in theory, in time, you'll be able to train enough algorithms to certainly bring the average standard of interpretation up towards the very best. Whether it will surpass humans, there's a lot of intuition and clinical information that goes into making a diagnosis.